Question 1. What is the main purpose of using reinforcement with a client? A. To decrease a challenging behavior. B. To help the client feel happy. C. To increase the future likelihood of a desired behavior. D. To stop a behavior immediately. Answer: C. To increase the future likelihood of a desired behavior. This question is about the fundamental principle of reinforcement. The core purpose of reinforcement in ABA is to make a specific behavior happen more often in the future. When a behavior is followed by a consequence that the individual values, they are more likely to repeat that behavior next time a similar situation occurs. It's not about decreasing behaviors, that's punishment or extinction, or ensuring immediate happiness, although positive interactions are important. Think of it as providing a payoff for desired actions, so the client learns those actions are valuable and worth doing again. Reinforcement is all about building up good behaviors. Question 2. If you are working with a client and are unsure how to implement a step in their behavior plan, who should you contact for clarification? A. The client's parent or guardian. B. Another RBT who works at your company. C. Your supervising BCBA or BCABA. D. Look up the technique on the internet. Answer: C. Your supervising BCBA or BCABA. This question is about the RBT's reporting structure and responsibility to seek guidance. As an RBT, you work under the direct supervision of a certified professional, BCBA or BCABA. They are the ones who designed the plan and are responsible for guiding you on how to implement it correctly. If you are ever unsure about any aspect of a program or behavior plan, it is essential and required that you seek clarification from your supervisor. Asking parents, peers, or searching online might lead to incorrect or inconsistent implementation. Your supervisor is your go-to person for all clinical questions. Question 3. In ABA, what is the definition of a behavior? A. Something a person feels or thinks. B. Something a person does or says that is observable and measurable. C. A label for a diagnosis or condition. D. The function or purpose of an action. Answer: B. Something a person does or says that is observable and measurable. This question asks for the precise definition of behavior from an ABA perspective. In behavior analysis, we define behavior as anything a living organism does or says that can be seen or heard and recorded by another person. It must be observable, you can witness it, and measurable, you can count it or time it. Feelings, thoughts, and diagnoses are not behaviors themselves, though they might be related to behaviors. The function is the reason for the behavior, not the behavior itself. Behavior is simply action that you can see and measure. Question 4. Which of the following is the best example of using positive reinforcement? A. A child screams, behavior, and you take away their favorite toy. Consequence: and they scream less often. B. You ask a child to clean up. Antecedent: they clean up. Behavior: and you say, "Great job." Consequence: and they clean up more often. C. A teenager finishes their homework. Behavior: to avoid having to do extra chores. Consequence: and they finish homework more often. D. A client hits their head. Behavior: and you ignore it. Consequence: and the head hitting decreases. Answer: B. You ask a child to clean up. Antecedent: they clean up. Behavior: and you say, "Great job." Consequence: and they clean up more often. This question asks you to identify an example of positive reinforcement. Remember, positive reinforcement means adding something desirable after a behavior to make that behavior increase. In option B, praise, "Great job," is added after cleaning up, and the behavior of cleaning up increases. Option A is negative punishment. Removing toy decreases behavior. Option C is negative reinforcement. Removing chores increases homework behavior. Option describes extinction. Ignoring decreases behavior. Positive reinforcement adds something good to make the behavior happen more. Question 5. Before you begin a session with a client, what type of assessment should you typically perform to figure out what items or activities might work well as rewards during the session? A. Functional behavior assessment, FBA. B. Skill acquisition assessment. C. Preference assessment. D. Vineland assessment. Answer: C. Preference assessment. This question asks how we identify potential motivators for a client. The key idea is finding out what the client likes so you can use it as a reward, reinforcer. A preference assessment is a systematic way to determine a client's preferences for items, activities, or social interactions. This helps you choose effective reinforcers to use during teaching and for reinforcing desired behaviors. An FBA is for finding the function of challenging behaviors. A skill acquisition assessment evaluates what skills a client has, and a Vineland is a broader developmental assessment. To know what they like right now, do a preference assessment. Question 6. When collecting frequency data on a behavior, what specific piece of information do you need to record along with the count of the behavior to be able to calculate the rate of the behavior? A. The intensity of the behavior. B. The topography of the behavior. C. The duration of the observation period. D. The function of the behavior. Answer: C. The duration of the observation period. This question is about the components needed to calculate rate. Frequency is just a count example, 10 times. Rate is the count per unit of time example, 10 times per hour. To turn a frequency count into a rate, you must know how long you were observing the behavior, the duration of the observation period. Intensity is how strong the behavior is. Topography is what it looks like. Function is why it happens. To get a rate, you need the count and the time you spent counting. Rate equals frequency divided by time. Question 7. What is the main role of an RBT during a behavior reduction plan? A. To determine the function of the challenging behavior. B. To select the appropriate intervention strategies. C. To implement the strategies outlined in the behavior intervention plan. BAP. D. To modify the plan if it doesn't seem to be working. Answer: C. To implement the strategies outlined in the behavior intervention plan. BAP. This question reinforces the RBT's core responsibility regarding behavior plans. Just like with skill acquisition, the RBT's primary role in behavior reduction is to carry out the procedures and strategies that the supervisor has written into the client's behavior intervention plan. BAP. RBTs do not determine function. A. Select interventions. B. Or modify the plan. D. On their own. These are supervisor responsibilities. Your job is to follow the plan exactly as your supervisor has directed to help reduce the challenging behavior. The BIP is your guide to helping decrease unwanted behaviors safely and effectively. Question 8. What is the term for the consequence that occurs immediately after a behavior and causes that behavior to decrease in the future? A. Reinforcement. B. Extinction. C. Prompting. D. Punishment. Answer: D. Punishment. This question asks for the term defining a consequence that makes a behavior happen less often. The key phrases are consequence that occurs immediately after a behavior and causes that behavior to decrease in the future. This is the definition of punishment. Reinforcement increases behavior. Extinction is withholding reinforcement for a previously reinforced behavior to decrease it. Prompting happens before the behavior. Punishment is anything that follows a behavior and makes that behavior less likely to occur again. Question 9. If a client is taught to say car when they see a picture of a car and later learns to say car when they see a real car or a toy car or a drawing of a car, this demonstrates: A. Maintenance. B. Discrimination. C. Generalization. D. Shaping. Answer: C. Generalization. This question is about a crucial outcome where learning applies to new situations. The clues are that the client is responding correctly to different forms of the stimulus: picture, reel, toy, drawing. After being taught with one type, this is an example of stimulus generalization. The behavior, saying car, is occurring in the presence of different but similar stimuli. Maintenance is performing the skill over time. Discrimination is responding differently to different stimuli. Shaping is reinforcing closer attempts. We want skills to generalize so they are useful in the client's everyday environment, not just with the specific materials used in therapy. Question 10. You need to take data on how many times a client hits their head. Which dimension of behavior are you measuring? A. Duration. B. Frequency. Count. C. Latency. D. Interresponse time. IRT. Answer B. Frequency. Count. This question asks you to identify the dimension of behavior being measured when you're simply counting occurrences. The phrase "how many times" points directly to frequency, also known as count. Duration measures how long the behavior lasts. Latency measures the time between a cue and the behavior starting. Interresponse time, IRT, measures the time between two instances of the same behavior. When you are just tallying how many times something happens, you are measuring frequency. It's just counting every instance. Question 11. What is the difference between positive reinforcement and negative reinforcement? A. Positive reinforcement increases behavior. Negative reinforcement decreases behavior. B. Positive reinforcement adds something. Negative reinforcement removes something, and both increase behavior. C. Positive reinforcement adds something desired. Negative reinforcement adds something undesired. D. Positive reinforcement is planned. Negative reinforcement happens naturally. Answer B. Positive reinforcement adds something. Negative reinforcement removes something, and both increase behavior. This question clarifies the distinction between the two types of reinforcement. The key is that both positive and negative reinforcement increase the likelihood of a behavior occurring in the future. The difference lies in how the reinforcement is delivered. Positive reinforcement involves adding something, like praise or a toy, after the behavior. Negative reinforcement involves removing something unpleasant, like a demand or a loud noise, after the behavior. Option 9 is incorrect because negative reinforcement increases behavior. Options C and misrepresent the terms. Remember, reinforcement is about increasing behavior. Positive means adding. Negative means removing. Question 12. If a client bites themselves and this behavior is maintained by the painful sensation it produces, it feels reinforcing to them internally. What is the likely function? A. Attention. B. Access to tangibles/activities. C. Escape. D. Automatic reinforcement. Answer D. Automatic reinforcement. This question gives a scenario and asks for the function. The clue is that the reinforcement comes from the sensation produced by the behavior itself, maintained by the painful sensation it produces internally. When a behavior produces its own reinforcement without involving another person or gaining/escaping something external, it's automatic reinforcement. Even if the sensation is painful to most people, if it serves to maintain the behavior for that individual, it's considered automatically reinforcing. Attention, access, and escape involve external consequences mediated by others or the environment. If the behavior is its own reward or punishment that maintains it in a different way, it's likely automatic. Question 13. What type of prompt involves showing the client exactly how to do the behavior? A. Verbal prompt. B. Model prompt. C. Physical prompt. D. Gestural prompt. Answer B. Model prompt. This question asks about a specific type of prompt based on how the help is given. The key phrase is showing the client exactly how to do the behavior. A model prompt is when the RBT or another person demonstrates the desired response and the client imitates it. Verbal prompts use spoken words. Physical prompts involve physical guidance. Gestural prompts involve pointing or other nonverbal cues. When you show them how to do it, you're providing a model. Question 14. When implementing a task analysis using forward chaining, you reinforce the client for independently completing. A. The last step in the chain. B. Any step in the chain. C. The first step in the chain, and then the first two, and so on. D. All steps in the chain during each trial. Answer: C. The first step in the chain, and then the first two, and so on. This question asks about a specific chaining procedure. In forward chaining, you teach the steps of a task analysis in their natural order, from beginning to end. You reinforce the client for independently completing the first step. Once they master that, you reinforce them for independently completing the first two steps, prompting through the rest, and so on, gradually adding more steps to the beginning of the chain. Backward chaining starts from the last step. Total task chaining attempts all steps in each trial. Forward chaining builds the chain from the beginning. Question 15. Confidentiality means: A. Talking about your clients only with their family members. B. Keeping client information private and sharing only with authorized people involved in their care. C. Ensuring the client's dignity is maintained at all times. D. Not discussing any client information with anyone, including your supervisor. Answer: B. Keeping client information private and sharing only with authorized people involved in their care. This question defines confidentiality, a core ethical responsibility. Confidentiality means protecting your client's sensitive information and ensuring it is only shared with those who have a professional need to know and are authorized, usually your supervisor and other team members. Option N is incorrect, as not all family members may be authorized and discussions must be professional. Option C is about dignity, a related but different concept. Option D is incorrect, as you must discuss client information with your supervisor. Confidentiality means controlling who has access to private details. Question 16. What is the most important information to include in your session notes? A. What you had for lunch that day. B. How you felt about the client's behavior. C. Objective, observable information about the client's behavior and progress on goals. D. Your personal opinions about the family or client's home environment. Answer: C. Objective, observable information about the client's behavior and progress on goals. This question is about proper documentation. Session notes are professional records used by the clinical team to track progress and make decisions. They must be objective, meaning they are based on observable facts and data, not personal feelings or opinions. Including what you ate, how you felt, or personal opinions is unprofessional and inappropriate. Focus your notes on measurable behaviors, data collected, skills taught, and how the client responded. Stick to the facts and the data in your notes. Question 17. If a client is having a behavioral crisis that involves immediate risk of harm to themselves or others, and a crisis plan is in place, what is your primary guide for how to respond? A. Your best judgment in the moment. B. The general company policies on behavior. C. The specific crisis plan written for the client by the supervisor. D. Asking the client what they need. Answer: C. The specific crisis plan written for the client by the supervisor. This question addresses responding to emergencies. When a crisis occurs, your absolute first priority is safety. If a specific crisis plan has been developed for that client by your supervisor, that plan contains the specific safety-focused procedures you are required to follow in that situation. While judgment and general policy are relevant, the individualized crisis plan is your direct instruction for managing that client's specific risks. Asking the client or relying solely on general policy isn't sufficient in a crisis. Follow the plan designed for that specific client emergency. Question 18. When using differential reinforcement to reduce a problem behavior, you are reinforcing: A. The problem behavior occasionally. B. Only behaviors that are incompatible with the problem behavior. C. A desired behavior while withholding reinforcement for the problem behavior. D. The absence of the problem behavior. Answer: C. A desired behavior while withholding reinforcement for the problem behavior. This question asks about the core idea behind differential reinforcement. Differential reinforcement, the R, involves reinforcing one behavior, a desired or appropriate behavior, while simultaneously putting another behavior, the challenging behavior, on extinction, withholding its reinforcement. This strategy teaches the client a better way to get their needs met. While some types of DR reinforce incompatible behaviors, DRI, or the absence of behavior. DRO. The overarching principle is reinforcing a desired alternative while ignoring or not reinforcing the problem behavior. You're reinforcing the right behavior and not reinforcing the wrong behavior. Question 19. A skill is considered to be under stimulus control when A. The client can perform the skill independently without any prompts. B. The client performs the skill only when a specific instruction or cue is given. C. The skill occurs automatically without conscious thought. D. The skill generalizes to many different settings and people. Answer: B. The client performs the skill only when a specific instruction or cue is given. This question asks about the concept of stimulus control. Stimulus control means a behavior happens more often in the presence of a specific stimulus, like an instruction or a picture, than in its absence. The stimulus, the STI, signals that reinforcement is available for that specific behavior. The behavior is controlled by the presence of that stimulus. Performing independently, A, is important but not the definition of stimulus control. Automatic behavior, C, isn't related. Generalization, D, is performing the skill in different contexts, not necessarily tied to one specific cue. If the client only claps when you say clap hands, the clapping is under the stimulus control of the instruction clap hands. Question 20. What is the difference between a primary reinforcer and a secondary, conditioned reinforcer? A. Primary reinforcers are tangible, secondary reinforcers are social. B. Primary reinforcers are learned, secondary reinforcers are biological. C. Primary reinforcers are biological/unlearned, secondary reinforcers are learned/paired with primary reinforcers. D. Primary reinforcers are for young children, secondary reinforcers are for older clients. Answer: C. Primary reinforcers are biological/unlearned, secondary reinforcers are learned/paired with primary reinforcers. This question asks you to distinguish between two types of reinforcers. Primary reinforcers are naturally reinforcing because they meet biological needs like food, water, warmth, and don't need to be learned. Secondary, or conditioned, reinforcers are things that become reinforcing because they have been paired with primary reinforcers or other strong secondary reinforcers, like praise, toys, money, tokens. Praise itself might not be reinforcing initially, but if it's consistently paired with getting a preferred snack, praise becomes a secondary reinforcer. Primary reinforcers are built-in rewards. Secondary reinforcers are learned rewards. Question 21. You're tracking a client's hitting behavior. You decide to record whether or not the behavior occurred at any time during each 5-minute interval of the session. Which measurement method are you using? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Duration recording. Answer: B. Partial interval recording. This question describes a specific type of discontinuous measurement. The key phrase is whether or not the behavior occurred at any time during each 5-minute interval. This is the definition of partial interval recording. You divide the observation time into intervals and simply mark the interval if the behavior happened at all within that time block. Whole interval requires the behavior to occur throughout the entire interval. Momentary time sampling records if it happens at the end of the interval. Duration records how long it lasts. Partial interval just needs a piece of the behavior in the interval. Question 22. When you are modeling a skill for a client to imitate, what type of skill acquisition program are you likely working on? A. Listener responding. B. Imitation training. C. Intraverbal training. D. Man training. Answer. B. Imitation training. This question asks you to identify a specific teaching program based on the method used. The clue is modeling a skill for a client to imitate. Imitation training specifically teaches the client to copy the actions or sounds that someone else, like the RBT, makes. Listener responding is following instructions. Intraverbals are conversational responses. Man training is teaching requests. If you are showing the client something and asking them to do the same, you are working on imitation. Question 23. If a client's behavior of crying results in their parent immediately picking them up, and the crying increases in the future, the function is likely attention, and the consequence is A. Positive punishment. B. Negative punishment. C. Positive reinforcement. D. Negative reinforcement. Answer. C. Positive reinforcement. This question asks you to identify the consequence type based on the scenario and its effect. The behavior is crying. The consequence is the parent picking them up, something added, positive. The effect on the behavior is that crying increases in the future, reinforcement. Therefore, it is positive reinforcement. Getting picked up was added, and the behavior increased. Punishment decreases behavior. Negative means removing something. Since something was added and the behavior increased, it's positive reinforcement. Question 24. What is the primary ethical guideline for RBTs regarding reporting suspected abuse or neglect? A. Discuss your concerns with the client's family privately first. B. Document your concerns but wait for concrete proof before reporting. C. Report your concerns immediately to your supervisor and / or the appropriate protective services agency as mandated by law and company policy. D. It is not the RBT's responsibility to report. That falls to the supervisor. Answer. C. Report your concerns immediately to your supervisor and / or the appropriate protective services agency as mandated by law and company policy. This question is about the critical ethical and legal duty of mandated reporting. RBTs are mandated reporters, meaning they are legally required to report any suspicion of abuse or neglect, even if they don't have proof. The report must be made promptly according to state law and company policy, typically involving informing your supervisor immediately so they can guide the process and potentially make the report themselves or direct you. You do not discuss it privately with the family, wait for proof, or assume it's not your responsibility. If you suspect something, you must report it. Client safety is the absolute priority. Question 25. You are supervising another RBT during a session as part of your training, though you are not yet a supervisor. You notice they are collecting data incorrectly. What is the most appropriate first step? A. Correct the RBT immediately and show them the right way to collect data. B. Stop the session and inform the client's parent about the error. C. Take over data collection yourself for the rest of the session. D. Make a detailed note of the error and discuss it with your supervising BCBA or BCAB later. Answer. D. Make a detailed note of the error and discuss it with your supervising BCBA or BCAB later. This question tests your understanding of your role and supervision hierarchy. Even if you are training to supervise, you are still an RBT and ultimately work under your own supervisor, BCBA/BCAB. You are not yet authorized to directly supervise and provide corrective feedback to other RBTs in an official capacity. A. Stopping the session or involving parents. B. Is inappropriate. Taking over data. C. Doesn't teach the other RBT. Your responsibility is to report your observations about other staff to your own supervisor, who is responsible for their training and performance. Document what you saw and report it up the chain of command to your supervisor.